Hi, I'm Sarah Leatherwood. I'm from York, Pennsylvania, and I stopped in here to see Dr. Gary because I've been having chronic TMJ issues, a lot of upper neck and shoulder issues stemming from the pain from my TMJ, and just overall kind of pain that was extending into headaches because of the TMJ. I've been dealing with the TMJ issue itself for about 10 years. The symptoms that I would have would range from waking up in the morning with grinding at night so hard that the headaches would be stemming kind of up the side of my jaw and obviously into my head. Depending how hard I would be grinding at night, I would have a lot of upper neck and shoulder tension and just overall discomfort. I was not capable of opening my mouth to bite a sandwich or be able to really turn my neck full radius, which again, I didn't realize how much I was suffering until I started to see the benefits of coming, but realizing I really did not have a lot of radius in my turn and being able to see over my shoulders. So again, just a lot of that upper neck pain and tension. So some of the things that I really worried about as far as having TMJ for as long as I did is I've dealt with these issues for 10 years. I'm obviously not getting any younger, and my worry and concern was what this was going to progress to as I continued to age. Obviously dealing with the pain, every morning and not knowing really what was causing that pain or why I would grind harder some nights than others. It really made it difficult as far as doing day-to-day daily activities, having continual headaches or having some of that continual pain. I obviously didn't want to live on ibuprofen or live on muscle relaxers or pain medication. So I knew that there had to be some other type of alternative or option that I could do. Prior to coming to Harcourt, I had seen several different doctors in regards to the TMJ issues I was having. I was given muscle relaxers to try and ease some of the pain that I was having and to hopefully help the grinding at night so that I wouldn't grind. I had also seen several different dentists as far as night guards, and then I had also seen even a surgeon as far as looking into options of what surgery would do down the road for me. Obviously none of those were routes that I wanted to take. I did do the muscle relaxers for a short amount of time and some of the over-the-counter medication and did not like the way they made me feel. Certainly did not want to continue those for years on end, just kind of masking the overall problem. So I was definitely looking for some type of other option or alternative to that. It's amazing to me how little I knew about chiropractic care prior to coming here. I actually learned about Dr. Gary from his wife in one of the networking groups that we were connected with, and basically was at wit's end as far as my pain level and seeing all these various doctors and not really getting the answers that I wanted, and almost joked with her at a meeting saying, "Your husband doesn't happen to deal with TMJ, does he?" And she said, "Yes, he does." And to my surprise, I scheduled an appointment and thought I have nothing to lose. I might as well try this route and see what it has to offer. Certainly liked the idea that there was no medication involved and it was more of a holistic approach, and couldn't have been more surprised with the outcome, obviously, of what chiropractic care has done for me. The staff is amazing here, just their attention to detail, their customer service, their friendliness. You work a lot with them, obviously, in your initial appointments when you're coming in, and they were extremely professional and kind. My biggest worry and struggle is I have a daughter that I stay at home with, and I was worried about how care was going to work for me having a young child that I would need to bring to the office. And they accommodated my daughter, they got to know my daughter's name, and she came to almost every appointment with me, and it was extremely helpful as a stay-at-home mom. Within the 4 months of care that I had, I've seen a dramatic improvement where I was to where I am now. Simple things, being able to eat a sandwich and being able to not have that pain when I wake up in the morning are huge for me. I have dealt with this for so long that I just kind of assumed that that was normal, and to not have that has been great. I can't recommend Dr. Gary and his staff enough as far as any issue that others might be dealing with. Certainly consider chiropractic care before you look into medications or surgery, or even doctor's offices as a whole. If you told me 10 years ago to look into chiropractic care for TMJ, I would have thought you were crazy. Dr. Gary listened to my needs and concerns and was really the first doctor to get into the actual trouble and issue that I had versus prescribing a medication or looking into potential surgeries. He was the first person to actually glove up his hand, go straight in my mouth, and go right to the problem within my jaw. And as soon as he did that, within seconds, my eyes started watering, and I said, that's my problem. That is where my pain is coming from. And so for someone to get right to the source that quickly in an appointment definitely made me realize that I had, found the right option and result for me.